to 6,000. Now, the South African Health Products Regulatory Authority, SAHPRA, as well as the Acting Health Minister, Mameluko Ngubane, have assured South Africans that the contaminated Johnson & Johnson doses will not be released in South Africa. Now, this comes after it has emerged that some batches waiting to be distributed from the Gqeberha Aspen plant in the Eastern Cape had been contaminated. SAHPRA has pleaded with South Africans not to panic, as there are emergency plans in place to deal with any crisis that emerges in the country.
SAHPRA has confirmed that 300,000 doses that have been approved by the US and Drug Administration will be released for shipment to South Africa. The product regulator says it's unclear at the moment when the doses will be shipped to the country. The organization also indicated that it is unclear whether Aspen will be reimbursed for the millions they have spent on the manufacturing of the doses that will not be used. The Johnson & Johnson vaccines will now be stored for 4.5 months instead of 3 months at the temperature of 2 to 8 degrees Celsius. The Health Ministry has assured that quality and safety of all COVID-19 vaccines will not be compromised.
Based on what has been announced by the FDA, we are affected in terms of those batches at the Gqeberha site. And what we have there on site is 2 million. I think some people were almost thinking that these are the batches, or we would have vaccinated South African citizens with these batches that are contaminated. I need to reiterate that is not correct. These batches have not been used. So I think South African citizens should not panic and worry. And what we will receive and use would be approved.
So the batches that are at the Aspen site that have been filled and finished, the ones that they were in question, those will not be released. So they cannot be made available to the public. However, there are doses from batches that have been cleared that will then be made available. So we will make sure that the country gets the correct batches of vaccine.
SAHPRA has also announced that contaminated doses will have a negative impact on government vaccination rollout plan.
It has impacted the vaccine rollout, plans of the country, because these were doses that were expected to be made available. But I think the public must have confidence in that, as a regulator, we will ensure that any product that is not of the right quality is not made available in the country. So there is a level of confidence that I'd like for the public to have, but it does indeed affect our rollout strategy.
South Africa has recorded over 80,000 new COVID-19 cases, with the number of deaths increased to over 57,000. Zolani Moya, SABC News, Gqeberha in the Eastern Cape.
For a weekly roundup of COVID-19 weekly stats, we're now joined by CSIR senior researcher Dr. Redvan Suleman. Well, very good evening, Dr. Suleman. Thank you for joining us. You're obviously seeing South Africa officially in a technical third wave. Latest stats emerging suggest that the daily COVID-19 cases per week are on the increase once again. Walk us through what that looks like.
Good evening, Lisa. Indeed, we continue to see a sustained increase in the number of reported cases nationally, as we have been seeing for the past 6 weeks. Even though we technically entered a third wave this week, in reality, we've probably been in a third wave for about 3 weeks, when the test positivity rate reached 10% and when the daily number of new cases or case incidents breached 5 new cases per day. Over the last week, we've seen a surge in Gauteng, and that's resulted in an even bigger increase nationally that we are seeing. The average number of cases we've reported over the last week is 6,848 cases per day, and that figure has increased by 48% week on week.
Dr. Suleman, comparing the third wave to the second wave and then also the first wave, what is ultimately reflected through these patterns?
So if we look at our current case loading, at 6,848 cases per day on average, that's up to 36% of the second wave's peak and up to 54% of the first wave's peak. Now, if we compare the rate of increase at the moment, a 48% increase is equivalent to new cases doubling about every 12 days. That rate of increase compared to a similar loading in the previous waves, it's now faster than what we were seeing during the first wave, where cases at a similar loading were doubling about every 2 weeks, but not quite as fast as what we were seeing during the second wave, where the rate of increase was doubling about every 10 to 11 days. But the trajectory seems to be moving towards what we were seeing during the second wave in the summer.
You were contextualizing the national overview. I want to hone in provincially now and look at the daily COVID cases per province. What has been shown through that data?
So Gauteng remains the most concerning and really driving the numbers that we are seeing nationally. Gauteng has reported over 28,000 cases over the past week, and that's about 60% of the total cases that were reported nationally. If we look at the curves of the different provinces, if you focus on the yellow curve, that being Gauteng, cases have increased by over 70% week on week. Gauteng now reporting an average of 4,100 new cases per day. In other words, new cases there are doubling every 9 days. The other concern as well at the moment now is the increase that we're seeing in the other three populous provinces, the coastal provinces of Western Cape. The cases have increased there by over 73% compared to a week ago. So there too, cases are doubling about every 9 days, and the case incidence in Western Cape is now up to 9 new cases per day per 100,000 people. So really getting to very concerning levels there. The other two provinces, Eastern Cape and KwaZulu-Natal, while the case incidence is low, the rate of increase is high. Eastern Cape up 45% and KwaZulu-Natal up almost 90% compared to a week ago. So all of those are a concern. Maybe some good news is that Northern Cape is now on a sustained decrease, down to 65% of its previous peak. Free State is showing signs of a decrease, not quite out of the woods, and hopefully it will continue to decrease.
Now, comparing, this data to the waves in Gauteng and also on the back of the announcements of the additional sites, in fact, 25 additional sites being announced within Gauteng province. I just want to know, how this is going to assist when it comes to testing and also, calculating that average test positivity rate per week in South Africa at large.
Sure. So in Gauteng, the number of new cases reported now is up to 77% of the previous wave's peaks. And if you look at the rate of increase, as mentioned, new cases there doubling every 9 days. The rise in Gauteng is steeper than what it was seeing in the previous 2 waves. So that really is a concern right now. I think every measure and all hands on deck are needed right now to control the spread in Gauteng, and particularly to maximize bed capacity. If we look at testing nationally over the past week, it has increased too. We've done over 44,000 tests per day over the last week across the country. And that's an increase of 16% week on week. The increase in testing is a reflection of more infections across the country, more people showing symptoms, and therefore more people presenting for testing. And so counterintuitively, it's a reflection of the infection curve or the rate of increase of infections.
Off the back of this now, we're looking at hospitals and also, what are the new COVID-19 hospital admissions per week in South Africa? Obviously, as you mentioned, as the numbers increase, this paints a rather concerning picture for South Africa heading into the next few months.
Yes, indeed, there remains a strong link between the cases and the test positivity rate, and then what we see with a bit of a lag, but in hospital admissions and thereafter in deaths. That strong link still remains. So after seeing an increase in the number of cases as well as the test positivity rate, that last metric also increasing over the last week, the test positivity rate up to over 15% nationally, and a week ago it was just about 12%. So we're finding a positive test for every 6.5 tests conducted. What it means is that in terms of hospital admissions, that too is now rising. The last week saw over 4,300 new admissions across the country, while that rate of increase of admissions has slowed, up 5% compared to a week ago. It is expected with the rise in cases and test positivity that hospital admissions will also increase going forward.
Now, with calls for stricter, lockdown restrictions, there's also the continued vaccine rollout plans that, is being unearthed in the country at large. I want you now to perhaps unpack the average daily COVID-19 deaths per week experienced in South Africa. What is likely to happen as we enter this third wave?
So we are starting to see a rise in the number of reported deaths nationally. The last week saw an average of 111 new deaths per day across the country, up 42% compared to a week ago. There is possibly a backlog of deaths being reported. However, if we look at the trend over time and also look at excess deaths and deaths occurring in hospitals, there's a notable increase of deaths in Gauteng and also a large number of deaths in Northwest. And in Free State, the number of deaths remain high. Because of that strong link between cases, hospital admissions, and then deaths, unfortunately, the number of deaths will continue to rise over the coming weeks as we continue to see more people being admitted into hospitals.
Also, SIR senior researcher Dr. Ridvan Sullivan, thank you very much for joining us. Of course, just giving us the latest regarding COVID-19 stats released in South Africa today. Now, we're going